Well, hi everybody. It's my day off. I'm here doing some patient notes and making some phone calls, but I also wanted to talk to you about writing multiple choice questions. Now, as a newly certified physician, you've probably been through more than 12,800 of these since medical school. So in a way, you're an expert, but when it's your turn to be on the other side and write the questions, it's easy to get hung up. So that's why I'm going to touch on the 7 do's and the 7 don'ts of writing multiple choice questions. The first do is to blueprint your examination. What topics do you want to cover? How many questions per topic? The longer the test, the more reliable an instrument, the more fair it is. But you have to be realistic. If you only have an hour to test people, you're going to be limited to 40 or fewer multiple choice questions. This next one is the most important one. Do have your learning objectives in mind. Do you want your learner to show that he or she can identify adrenal insufficiency in the ICU, or recognize a pneumothorax by ultrasound, or treat severe community-acquired pneumonia? If you're one of my chapter authors, you only have 3 questions for your whole chapter. So it has to be something either very important or very serious and deadly. And you might want to focus on areas where clinicians often make errors, because then you'd have a really high impact. Next is do follow the correct format. Item stem, lead-in question, and then 4 or 5 answer choices. The item stem is a linear story. Age, gender, setting, chief complaint, duration of that complaint or issue, maybe relevant past medical history, physical exam, perhaps some data, and then occasionally subsequent hospital course, response to results, and then other data. The lead-in question has to be specific, and it should not stand by itself. It should reference the vignette, the item stem above. What's the most appropriate management? What's the next best step in diagnosis? What's the best explanation for the underlying cause or pathophysiology of a finding? And then your answer choices. 4 or 5 is the convention, with 1 being the best answer, the others being plausible but less correct. Sometimes you can have fewer choices, especially if your distractors aren't very good, but usually it's 4 or 5. Next is practice the cover test. You know, just like in clinical practice, your patients don't show up with answer choices. So you should be able to cover the answer choices and just read the item stem and the lead-in question. And if someone knows what they're doing, they should be able to answer your question without even seeing the answer choices. So next is number 5, do write an answer key, right? Why is the answer choice that is correct? Why are the other ones wrong? But I also want you to expand upon what about the item stem could be changed to make a wrong answer a correct one, and vice versa. So compare and contrast. And do have 1 recent good reference. This is a check on yourself to make sure you don't have your own clinical bias and that you're not wrong. And it's also nice to have, should a learner challenge the test that you're writing. Number 6, don't forget peer feedback. You know, shop these questions around, especially if it's a high-stakes test, before you use it. Do get some feedback and modify these questions from your colleagues. Well, I'll get back to that 7th do in just a second. Right now I want to talk about the don'ts. And broadly, this has to do with the fact that you don't want to punish people who know your material by adding irrelevant difficulty to your question because of formatting problems. And similarly, you don't want to reward savvy test takers who don't know their stuff just because you've inadvertently supplied a cue or clue to them. So number 1, don't put your correct answer as C or B all the time. That's where people are looking. Just list your answer choices in alphabetical order every time, automatic. Number 2, make sure all your answer choices are the same length in addition to being grammatically correct. Usually we're more invested in our correct answers, and those tend to creepily get longer. Make them all the same length, preferably very short, even if you have to make the item stem above even longer. Number 3, don't allow a clang clue or convergence. And by this I mean you don't want to repeat a word that was in the item stem in the correct answer choice. That's going to trigger people to just choose that by chance. You also don't want to have, say, 3 of the 5 items have the same word in it or be from the same class, because then people will converge into the correct answer. Number 4, don't have markedly abnormal information up in the item stem that's not part of the correct answer choice, because that's just an unfair distractor. Number 5, don't use absolute or ambiguous terms. Absolute terms like never, always, must have, because test takers can find a case report to prove you wrong. Ambiguous terms like usually, sometimes, often, avoid those too, because it's been shown that test takers interpret those words differently. Number 6, don't use lead-in questions or with the words except, or don't ask people to find the least likely alternative. First of all, people miss that word, so that's kind of annoying. But also, it's unfair throughout the whole test. You're asking them to find the right answer, and suddenly you have them shift their gears to find the wrong answer. So those questions are usually not used in high-stakes tests anymore. Number 7, don't use none of the above as an answer choice, because that quickly turns your multiple choice question into a true-false question. And then things like choose A plus B and C plus D, it just adds unnecessary complexity and takes too much time. And then finally, the last do, number 7, do look at the psychometric properties of the test after you've given it. Not just the mean and the standard deviation, but look at each question, specifically the difficulty index, right? If it's less than 0.5, half the people are getting it wrong. It's probably too hard. If it's greater than 0.85, maybe it's too easy. And then the discriminating index, which tries to show you how people do on that question compared to the test overall. So if you're testing one big domain, if that number is less than 0.3, and certainly if it's less than 0.10, you might have to throw it out, because that means poor test takers are getting that question right, and vice versa. People who know the material are getting that question wrong. Look at the distribution of answer choices, right? If no one is picking one of your wrong answers, maybe it's not plausible enough. Or if a lot of people are picking the same wrong answer on a question, you might find when you look back that your multiple choice question actually has 2 correct answers and needs to be modified. All right, folks, I have some references, including the NBME item writing guide in the comment section below, some other links. Please add your own links and advice, and good luck as you write your multiple choice questions.